Hello everyone, my name is Poonam Mujmule. I am the student of Brisson Institute. Today's topic is types of adverse event. Adverse event. In adverse event, it is referred to as unintended or harmful medical occurrence experienced by patient during the use of the drug, whether or not the drug is directly responsible. In adverse event are a critical pharmacovigilance and drug safety monitoring, and they can be categorized based on their characteristics and clinical significance. First is classification by causality. In this, first is adverse drug reaction. Adverse drug reaction, it is a harmful or unintended reaction directly caused by the drug when used at a normal dose. Then example of this is liver damage due to the paracetamol overdose. In this, there is next is non-drug related event. In a non-drug related event, medical issue not directly caused by the drug but occurring due to its use. Uh, for example, for this accidental injury or unrelated drug pharmacological effect. Next is a classification by predictability. In this, there is type 1. It is also known as a augmented reaction. Augmented reaction, it is a predictable and dose dependent, and it is related to the drug's non pharmacological effect. Then in this, the for example, hypoglycemia, it is caused by the insulin. Type B, it is also known as a Bayesian reaction. Type B, it is a unpredictable and not a dose dependent, and it is often caused by hypersensitivity or idiosyncratic reaction. For example, anaphylaxis due to the penicillin. uh, Third, classification by severity. In this, first is mild adverse event. In mild adverse event, do not require any medical intervention. Example of this, mild nausea or headache. Then next is a moderate adverse event. In moderate adverse event may require a treatment, but are not a life threatening. Example of these, severe rash requiring antihistamine. Next is a severe adverse event. In this severe adverse event, it is a life threatening or resulting in hospitalization, disability, or death. For example, severe bleeding due to the anticoagulant therapy. Next is a classification by a timing. In this classification by timing, first is a acute reaction. In this, it is acute reaction. It is occur immediately or within hours of a drug administration. Example of this is allergic reaction like swelling. Then subacute reaction. In subacute reaction, it develop over a days or a week. Example, bone marrow suppression caused by a chemotherapy. Then chronic reaction. In chronic reaction, it develop after a prolonged use of a drug. Example, kidney damage due to the long term use of the drug. Then next is the classification by mechanism. In this classification by mechanism, in this first is allergic reaction. In immune mediated hypersensitivity to the drug. Then example of this is urticaria, and is this urticaria is caused by a sulfur drug. Next is a idiosyncratic reaction. This reaction it is a rare and unpredictable or unrelated drug. Um, Example for this is hyperthalamia, and it is triggered by anesthesia. Next is drug food interaction. In drug food interaction, there is unintended effects caused by interaction between the drug or food. For example of this, increase the bleeding risk when warfarin is taken with aspirin. Then next is special categories. In this unexpected adverse event, the unexpected adverse event which is not listed in drugs labeling or documentation. Example, new side effect discovered during the post marketing surveillance. Then serious adverse event. In serious adverse event, there is a result in a death, life threatening condition, or a significant disability. Example of this is a myocardial infarction, which is caused by a certain drug. And adverse event in a special population. In a special population means a group like pregnant women, children, or elderly people. Example, tetragonic effect of thalidomide in a pregnant woman. Thank you.